Hello dear friends, I am Dr. Monica Singla. I am Associate Professor in Department of Neurology, DMCH Ludhiana. I am going to discuss about epilepsy. Epilepsy or seizure. It's a very common disease in India, in developing countries. We see so many patients every day of epilepsy. So what is epilepsy? Epilepsy means person who has recurrent seizures or fits in common language we say. It's a very common disease, but we should not be scared of this disease. Epilepsy usually happens in children. It's more common in younger age. It can happen in the early age, in childhood or in juvenile age group or adolescents, but it can also be seen in the middle age or elderly people. So I am going to discuss what are the common causes of epilepsy. Epilepsy can happen because of the childhood infections. It can happen because of the worm infection, that is neurocysticercosis. It can happen because of the tuberculosis, in HIV, in other chronic infections. It can happen because of any developmental delay or people who are not born normally in the childhood. It can happen because of the genetic causes. Sometimes epilepsy travels in families. Or in the middle age, it can be because of the stroke, it can be because of any roadside accidents. Because of the roadside accident, there can be clot in the brain that can lead to epilepsy in the later age. In the elderly people, sometimes there is no cause, or because of the tumor, because of the stroke, it can happen. What is the common presentation of seizure? Usually, there is jerky body movements of the body. It can happen suddenly. When there is sudden onset jerky movements of the body, it can be seizure or fit. So what should we do if we see any patient of seizure in our family or in the neighborhood? So first of all, if somebody is falling or somebody is having seizure suddenly, we need to clear the surroundings of the patient. We should try to ensure that there should be nothing nearby the patient, that if some heavy thing is there, some table, some chair, some furniture is lying, or some sharp object is there, we should try to clear all the things from nearby the patient, because during the seizure, patients having involuntary jerky movements, they can hit their body, their head with the things. So we should try to clear that. Second thing, we need to take care if somebody is having jerky movements, we should not try to control these movements. What people do normally, they try to hold the body of the patient and they try to control the seizure. My dear friends, that does not control the seizure, but it injures the patient. It can break the bones, or it can lead to shoulder dislocation or pelvic dislocation. So please, we should not try to control these jerky movements. Third thing, till the time patient is seizuring, we should not do anything. But if the body is relaxed and patient is not having any involuntary movements, we should try to give the sight to the patient, so that if there is any saliva in the mouth, that should not go to our lungs. That will come out of the mouth and patient will not aspirate. Otherwise, they can develop pneumonias. So once a patient gets conscious, only then we should try to give some medicine. Only then they should be swallow something. We should not give anything to swallow or anything by mouth. Any food or water, we should avoid that. And some people, what they do, they try to make them sniff the shoe. That's not advisable. About 70 to 80% of seizures, they can be very well controlled with medicine, with 1 or 2 anti-epileptic drugs. If these seizures are not controlled, then these patients should be properly investigated in telemetry unit or video EEG. This facility is available in DMC. We usually admit this patient for 5 days and we record their EEG and we do the continuous monitoring. Then we try to find the focus of the epilepsy. If the MRI, EEG and seizure semiology shows the same type of focus, then these patients can be helped with surgery. So dear friends, we should not be scared or afraid of this epilepsy. This is quite controlled and easily treatable with medicines or surgery. If you have any queries related with epilepsy, you are most welcome to share your questions or comments in the chat box below. I like to answer all the queries in my next video. Till then, stay home, stay safe. Take care.